Hi, in this video, we are going to discuss about principles of health educations. Before that, first we have to know the definition of health educations. So, the definition is a process aimed at encouraging people to want to be healthy, to know how to stay healthy, to do what they can individually and collectively to maintain a health, and to seek help when needed. So here they are mentioning that encouraging. So encouraging means how we are encouraging that people with healthy habit and unhealthy habit. So you are giving some examples about the healthy behavior and the unhealthy behavior, and if you are following unhealthy, what are the consequences will come in your future. If you are following the healthy, what are the consequences and what are the benefit you will be seeing in the future. So like that, the correlations you have to be make with healthy behavior and unhealthy behavior. So if you know that unhealthy sequence in the future, automatically the people will go for the healthy habit. So if they are get sick also, first that the starting stage itself they have to come for the help in the earlier stage. For example, when the patient is having cough for 1 week or 2 week, immediately they have to go for the hospital. Why it was being a long period of time. Okay, so earlier seeking help, it will be halt some disease conditions in the earlier stage itself. Okay, so that's all about definition. Next, we'll move on to the principles of health educations. So there will be 13 principles of health educations. There are credibility, interest, participations, motivation, comprehension, soil, seed and server, learning by doing, known to unknown, reinforcement, setting an example, good human relations, feedback and leaders. So these are the 13 principles are involving in the health education. So we'll see one by one. So the first one is credibility. So credibility is a message should be trustworthy. Whatever the message you are giving to the public, it should be a true one. Okay, you're not supposed to contain the false informations into that one. It's based on facts and consistent, compatible with scientific knowledge and social goals. The next one is a interest. It should be based on felt needs of the people. The next one is participations. So participation, you have to encourage the people to participate in the health education program. For example, you're giving that some skit or mime for the people itself. They have to be act in the mime show or in the drama. So that time they will have a participations. Not only the drama, any programs were conducting in that community area, in the time also we have to involve the people. So motivations, there are two type of motivation: primary motive and the secondary motive. How primary motive will create means, it will be inborn desires, food, clothing, housing and all, it will be motivated. And secondary motives, it created by outside forces like prize, reward, love and punishment, like that. So the next one will be the comprehensions. So it will be at the level of understanding of the people. You have to give a educations, communicate in the language people understand, that means the local language. Don't use it strange words and all, the local words you can use it of. The next one is a soil, seed and sower. Soil means people to whom health education is given. Seed means health fact, and server means media used to transmit the facts. So the next one will be the learning by doing. So if I hear, I forget. If I see, I remember. If I do, I know. So based on this fact, you have to be give educations. So the next one, known to unknown. Always you have to go from easy to difficult, from psychology to psychiatry, like that. The next one is reinforcement. So repetition, the booster dose will give a good way of education. Setting an example, each and everything we are giving one example. For smoking, family size, like nuclear family, joint family, everything. The next one is a good human relations. So in the good human relations, sharing information, ideas and feelings happen most easily between the people to create a good relations. The next one is a feedback. So one of the key concept of the system, so modify the elements of the system. So example like the message, the channel, these and all we have to give. The next one is leaders. So leaders, it's take a initiative and they have to give a proper guidance and easily accessible by the all peoples. So that's all about the principles of health education. Thank